Welcome to Let's Talk Micro. Hello, everyone. Welcome to another episode of Let's Talk Micro. I hope you had a great week. As always, Let's Talk Micro it's available on Apple Podcasts, Spotify, TuneIn Radio, Google Podcasts, Stitcher, Overcast, Pandora, Amazon Music. Wherever you listen to your podcast, you can find Let's Talk Micro. As far as social media, I am always on Instagram as Let's Talk Micro, no apostrophe, and on Twitter as Let's Talk Micro 1. So go ahead and follow. I always like to post pictures of organisms, and I always give updates as to when the next episode is coming out. So follow, go ahead and leave a comment, leave a review, or even suggest some possible episode themes. I'm open to suggestions. So go ahead and check out all the other episodes. So on the previous episode, I went over Group B strep. So I talked about the Landsfield classification system, where Streptococcus pyogenes is strep A, and then Streptococcus agalactiae is B. So if you hear me mention, I can say Group B strep or Streptococcus agalactiae. So it is a catalase negative, beta hemolytic, gram-positive coxine chains, and it is latex B positive for that Landsfield system. So it's the textbooks say that it is part of the female genital tract. It tends to be more of a colonizer, and it is a very significant organism that is implicated in neonatal sepsis and meningitis. So I talked about this in the previous episode. 10 to 30% of the cases where you have your neonatal issues, you have colonization with Group B strep on those cases. So to prevent this, the patient gets screened between 35 to 37 weeks of gestation. They get a vaginal rectal swab, and then in the lab we test it several ways. So we can either perform a PCR test, which I will talk about in this episode, or there are nucleic acid methods or blood cultures. However, by the time you test it in blood, it means that the baby got it at birth from the mom, and your baby is at risk. So before birth, we perform PCR testing, and we perform the standard Group B strep culture. So I mentioned in the previous episode that I grow some blood, chocolate, PEA. So in this Group B culture, what do you set up? So you set up a blood plate and a Todd Hewitt broth. And then you incubate them and examine the plate and broth at 24 hours. If the broth is turbid, which in all likelihood it will be, you subculture the broth. Then you examine the blood plate at 48 hours and the broth plate at 24 and 48 hours. If you see beta colonies, you can perform typing or set up an identification on instruments such as Vitek or Molotov. And I started talking about this on the previous episode, but susceptibilities are not performed. The organism is treated with penicillin. If the patient is allergic, which the provider typically lets you know, then susceptibilities are performed. But because of the significance of this organism, it needs to be ruled out. Meaning, if you see it, you have to test it, you have to report it, regardless of the colony amounts. On patients of childbearing age, and your lab has a protocol for this. And I mentioned that the colonies are like a milky white and they're beta hemolytic, not as strong, the hemolysis not as strong as it would be on your strep pyogenes or your strep, Galactiae, which are, C and D, Landsfield groups. So those have a stronger hemolysis. But with this one, it tends to be not as strong, and the colonies are milky white. And there is something that you have to be careful, because there's also another organism that is involved in meningitis for neonates. And the colonies are also whitish, and it has a beta hemolytic, pattern, which is very similar to that of Group B strep. And this organism is Listeria. So they do resemble each other on the plate. But as always, look at your gram stain, perform a gram stain on the colonies, and also there's a test that differentiates them. As far as gram stain, group B strep is gram-positive coccyne chains, whereas Listeria, they are short gram-positive rods. Also, group B strep is catalase negative, and Listeria is gram-positive. It's catalase positive. So keep this in mind. I mean, sometimes, especially if you're brand new at this, you might go through them. Sometimes, you're going too fast and you might mistake them for one another. However, Listeria, you see it is not as frequent as you will see group B strep. But nevertheless, keep that in mind, that they do resemble each other on the blood agar plate. But, one is a coccyne, one is a rod, one is catalase negative, and one is catalase positive. So on the previous episode, I started talking about the Todd Hewitt Broth. So what is this broth? Well, it is used for the cultivation of group B strep. And there's a popular version of it, which is the limb broth. And those of you that work in the lab, you probably, you're familiar with this one. So this is a Todd Hewitt broth supplemented with antibiotics. And today I want to go over the BD-BBL limb broth. It has peptones, dextrose, and salts. It also has yeast extract, and all this provides nutrients and vitamins to stimulate growth. The dextrose stimulates hemolysin production. It has nalidixic acid and colistin. And what do these do? Well, they suppress the growth of gram-negative bacteria. So this is very easy to set up. You place the vaginal rectal swab in the broth, then you cap it and incubate it in a non-CO2 incubator with the cap loosened at 35 degrees for 24 hours. It can be examined from 18 to 24 hours. If turbidity is observed, then subculture the broth to a blood agar plate. Then you examine the plates at 24 and 48 hours, like I mentioned. If the broth is not turbid, then you can keep the broth for an additional day. And like I mentioned, you set this broth with the blood agar plate, so the whole process takes 3 days. Your blood plate, if it doesn't have group B strep-looking colonies, you keep it for 2 days. So at day 1 of examination of your blood plate, you look at your broth that is turbid, so you sub it out to a blood agar plate, and you continue looking for group B colonies for 2 days. And then your original blood plate is good after 48 hours, and you're done with it. So very standard setup. I mean, this is the very common, because depending on the size of your lab, not all the laboratories, they have PCR instruments, but almost everyone does have blood plates, and they purchase this broth. So the group B strep culture, it's a very common and standard method. Now, in the previous episode, I mentioned that just like group A strep, Cepheid also makes a group B strep test. And I'm actually going to be talking about 2 of them in this episode. So one of them is the Gene Expert, the Cepheid GBS LB. Can you guess what the LB is for? If you thought limb broth, you are right. So this is an in vitro qualitative test to detect GBS from enriched rectal vaginal specimens. It is a PCR test. So like I mentioned, right? So pregnant patients, they get screened at 35 to 37 weeks of gestation. And I just talk about limb broth. So this test is performed in limb broth that has been incubated from 18 to 24 hours. So now this test kind of just takes away from, it's an alternative to the culture. So you get that swab that's collected, the vaginal rectal swab. You place it in limb broth. And just following the procedure I described, you incubate it for 18 to 24 hours. Once that period is over, your broth is mixed. Then you place a clean swab on the broth, and that swab goes in the test cartridge. Then your cartridge is closed and placed in the Gene Expert instrument following the testing procedure. So the test takes approximately 55 minutes. It is resulted as GBS positive or negative. If there's an error, no result, or an invalid message appears, then the test needs to be repeated. You might be thinking, does a negative result need to be confirmed by another method? And with this one, no. I mean, it's already enriched. You already took that swab. You place it in an enrichment broth that you incubated for 24 hours. So you make sure that, if there was anything in there, as far as group B strep, the test will be able to, it would be able to detect it. So once you get your negative result, you are done. I mean, if you have a positive result, depending on, I mentioned that you don't do susceptibilities on it because you treat it with penicillin. But if the provider, makes a note on the file saying this patient is allergic to penicillin, then at that point in time, if you get a positive result, you will have to sub it out to a blood plate so you can go ahead and perform susceptibilities if that's what's needed. But at the same time, keep in mind that this happens. It doesn't happen too often, but it does happen. That this is a PCR test, so it's detecting DNA. So there's a possibility that your organism might be not non-viable. I've seen it happen. You get a positive result. You plate it. You plate your broth to a blood culture plate, blood agar plate, and then nothing grows. So the organism might be non-viable. So keep that in mind. But it is not as frequent. So you should be able to get growth on a blood agar plate. But this is only if they request susceptibilities for it. Now, the next test that I want to talk about, like I said, is also from Cepheid. So up to this point, we are on screening mode. The patient is at 35 to 37 weeks of gestation. They had that swab collected. And then you perform either a culture, go through that process. Or then you can, perform that PCR process. But at this point in time, the patient is not on active labor. So this test that I'm going to talk about is when the patient is actually on active labor. This is the expert GBS test, also a PCR test, and it is useful to detect antepartum and intrapartum colonization and to identify candidates for intrapartum antibiotic prophylaxis. So maybe the patient didn't have it done before, didn't get to do the screening, and now the patient is on active labor, and the doctor needs to know, is the patient colonized with group B strep? And if so, the patient needs to be treated. It is a simple test. You place the swab in the test cartridge and perform the test following your instrument testing procedure. It takes about 50 minutes or less, and it is resulted as GBS positive or negative. Retesting for invalid error or no results, it's going to depend on the facility's criteria. So there should be alternate methods. But what we do is, we typically repeat it if you get some sort of error. Your facility might also have you set a culture on samples that are negative to confirm this result. Since, it wasn't enriched, I mentioned on the GBS LB, you had that swab for 24 hours, so it wasn't enriched. So you went through a comprehensive procedure, so you don't confirm it. But with this, you're just testing the swab. So there might be the potential for a false negative, or maybe it wasn't enough. So they might have you set up a culture on it just to confirm the fact that it is actually negative. So now that you know 3 tests, let's go over and compare and contrast them. So let's start with the culture, standard method. Some of the cons are that the overall process can take 3 days, right? Your initial blood plate, 2 days. On day 1 of your blood plate, you're examining your lymph broth, and then it's cloudy. You subculture it for 2 days. Sometimes, maybe your sample might have arrived late at the lab, so that lymph broth might not be within those 18 to 24 hours. So you might have to wait an extra day, bringing the whole thing to 4 days. So those are 4 days that the doctor is waiting for the patient results. Now with the GBS-LB, there's definitely some improvement. It's a day turnaround. So that's, it's better. So it's still a day. With the GBS, the regular GBS, it is a fast test. But then again, it's not an enriched process. So you might have to confirm, you get a result right away. So if it's positive, it's definitely good because the physician gets the result right away. But if it's negative, you might have to confirm it. So that's going to take another 2 days, depending on which method. I mean, if you have to confirm it by a culture, then you just bought another 3 days. So they have their pros and cons, but definitely your limb broth is very popular. It's an enrichment method. And even though it does take a while, it takes a whole day for the GBS-LB and potentially 3 for the culture. Once you get a negative, you have definitely the pretty good test because you have gone through the process of enrichment, and at that point in time, you have successfully ruled out group B strep. So this is definitely a very fascinating organism, and you definitely will see it a lot. But it's typically when you have it once you have identified it, something as simple as putting it on the moldy top, or just doing the typing, which is very easy. You listen to the episode with the procedure. It's fairly quick. So once you have that agglutination, you're done. And also, unless your patient is allergic to penicillin, once you have identified, you are done with it. But keep that in mind that it's something when you are working cultures, especially a lot of new techs, they get put on the urine bench right away. It's typically the first one that you start. So keep, as you're working, look out for those colonies. You get your plate, put it against the light so you can watch out for hemolysis. And then if you see it, look at your patient's age. If the patient is within childbearing age, you have to work it up. You have to report it no matter the colony amount. And just to close on this, I mentioned, typically, as I just said, that techs, get put on the urine bench when they start. This is one of the places where you're going to see it more often. I mean, you do see it on other, you see it on the wound bench and in other areas as well. But definitely on the urines, I mean, it likes to colonize the, female genital area. So that's where you're going to see it the most. And out of curiosity, if you're wondering why do the techs get started on the urine bench first, it is because it tends to be a great place for the techs to get used to the organisms. Typically you have the uropathogen, the one that's causing the infection. And if not, then you have a lot of normal flora. So it's a good way for the techs to start training the eyes on what is mixed flora looks like and start getting a good grasp on the organisms. It is a little bit easier. Once you get to the wound bench, you start getting all these non-fermenters. Also, you start getting more organisms like your Pasteurella, Actinomyces. So definitely the probability of you getting, the scope of organisms definitely widens a lot. Whereas on the urine, it's typically more restricted to Enterobacterales, some non-fermenters, definitely see pseudo. You can get your strep, your Enterococcus, and then your normal vaginal flora organisms. So it's just an FYI for those of you that work in the lab and thinking, why the urine bench first? Just an FYI. And I also wanted to mention that, because I earlier said that Streptococcus dysgalactiae, by mistake I said Lancefield groups C and D, but it's actually C and G. So just for the record. And that, my dear audience, is the end of this episode. Hope you enjoy learning about Group B strep testing. This is some good information to know, especially such a significant organism that can cause is involved in neonatal sepsis and meningitis. So continue educating yourselves. Always, information is power. Review your organisms, review your textbooks, and bring that passion. Acquiring all this information is only gonna make you better at your job. The more you know, the more you can make sure you don't miss organisms. So continue staying motivated, stay safe, and stay tuned. Like I said, we have some great interviews coming your way. So stay safe, and of course, continue talking micro. Until the next time, bye.